Imagine waking up tomorrow and discovering that a war happening thousands of kilometers away is affecting your food, medicines, mental health, and even the air you breathe. Sounds impossible? But history has shown that major wars rarely stay local. The growing tension between Israel and Iran has raised global concern. While politicians talk about military strategy, very few people are talking about something equally important: global health consequences. Could this conflict trigger disease outbreaks, medicine shortages, pollution, and mental health crises worldwide? In this video, we will uncover hidden health risks of global conflicts, real-life stories from previous wars, myths people believe during crises, and most importantly, how you and your family can stay safe. Watch till the end because the last point could protect your family during any global crisis. 1. Air pollution and respiratory diseases. When wars damage oil refineries, factories, and fuel storage facilities, massive clouds of toxic smoke are released. These pollutants contain sulfur dioxide, carbon monoxide, heavy metals, fine particulate matter. These microscopic particles travel across continents through atmospheric currents. Health effects may include asthma attacks, chronic obstructive pulmonary disease, COPD, lung infections, increased heart attack risk. During the Gulf War, burning oil wells in Kuwait produced thick smoke that spread across the Middle East for months. Hospitals reported a sharp increase in respiratory illnesses and eye irritation. Experts fear similar environmental damage if major oil infrastructure becomes a target. 2. Water contamination and food safety risks. War damages pipelines, factories, and sewage systems. When this happens, toxic chemicals can leak into water and soil. Possible health problems include diarrheal diseases, cholera outbreaks, heavy metal poisoning, long-term cancer risk. Real story. After the Iraq War, damaged water systems in many areas led to increased waterborne diseases among civilians. This shows how war can silently affect health for years. 3. Radiation risk from nuclear facilities. One of the biggest global concerns involves nuclear facilities. If nuclear sites are severely damaged, radioactive material could be released. Possible health consequences: acute radiation sickness, thyroid cancer, leukemia, birth defects. Real story. After the Chernobyl disaster, radioactive particles spread across multiple countries in Europe. Even today, some regions still experience higher cancer rates. 4. Global food shortages and malnutrition. Many people don't realize this, but wars in key regions can raise food prices worldwide. This happens because conflicts disrupt shipping routes, fuel supply, fertilizer production, agricultural trade. If oil prices rise, the cost of transporting food increases. The result? Higher food prices and food shortages in poorer countries. Children are the most vulnerable to malnutrition and weakened immunity. 5. Medicine and healthcare shortages. War disrupts global supply chains. This can cause shortages of antibiotics, insulin, cancer medicines, vaccines, medical equipment. Even countries far from the conflict may face delays in drug supplies. During the COVID-19 pandemic, we saw how fragile global medical supply chains can be. 6. Infectious disease outbreaks. War often creates crowded shelters and refugee camps. These conditions allow diseases to spread rapidly. Common outbreaks include tuberculosis, measles, cholera, respiratory infections. Organizations like the World Health Organization warn that conflict zones frequently become hotspots for infectious diseases. 7. Mental health crisis. Global conflicts don't only affect the body, they also affect the mind. People around the world may experience anxiety, sleep problems, depression, fear of nuclear escalation. Children are especially vulnerable when exposed to constant news about war. Mental health experts advise limiting exposure to distressing news and maintaining daily routines. 8. Economic stress and health problems. Global wars often trigger economic instability. If energy supplies through the Strait of Hormuz are disrupted, oil prices could rise sharply. This may cause inflation, increased poverty, reduced healthcare access. When families struggle financially, healthcare and nutrition often suffer. Myth versus fact. Myth 1. A war far away cannot affect my health. Fact. Global conflicts influence food supply, medicine availability, pollution, and mental health worldwide. Myth 2. Only soldiers suffer health problems during wars. Fact. Civilians even in distant countries often experience indirect health effects. Myth 3. Stockpiling medicines is unnecessary. Fact. Short-term shortages can occur during major global disruptions. Practical health preparedness tips. Here are simple steps families can follow. Keep 2-4 weeks of essential medicines. Store basic emergency food supplies. Maintain a small first aid kit. Keep N95 masks for air pollution. Ensure safe drinking water availability. Keep health records and prescriptions accessible. Limit exposure to stressful news. Maintain a healthy lifestyle to strengthen immunity. We cannot control wars, but we can control how prepared we are. Staying informed, protecting our health, and supporting each other can make a huge difference during uncertain times. Share it with your family and friends because awareness can save lives. And if you want more practical health information like this, subscribe to the channel at Scariva and stay prepared, stay informed, and stay healthy.